Today, I will going to talk to you about coronavirus. It's COVID-19. I picked this topic because I believe that we have a moral obligation to voice out our concern for our families or our friends and stand by our governments to eradicate this disease once and for all. Today, I will tell you about the ongoing crisis all over the world because of coronavirus. I will give you some information about the virus itself, the transmission, the symptoms, the treatment, and how we protect ourselves and others. Coronavirus, identified in 2019, is thought to have came from a wet market that sold exotic animals foods from Wuhan, China. The first outbreak cases in December 2019 is also known from Wuhan, China. COVID-19 is abbreviation name for the novel coronavirus. Most scientists believe is considered zoonotic virus. A zoonotic virus is meaning that it originated from animals and then spread to humans. The coronavirus COVID-19 is still currently spreading all over the world and resulted in more than 2.9 million cases today with almost 200,000 deaths. According to Johns Hopkins University, more than 60,000 people have died in the US today. Transmission. The virus is transmitted by direct contact with body fluids, and it can be primarily from person to person and through coughing and sneezing. Coronavirus tend to spread quickly through families and friends as they are exposed to infectious secretions. As they are exposed to individual, also transmission usually happens in healthcare settings in the absence of adequate infection control precautions. Coronavirus symptoms are influenza-like and include fever, shortness of breath, tiredness, dry cough, fever, sore throat, runny nose, diarrhea, headache, and other they may not have symptoms at all. Although fever is the most frequently reported symptoms, according to CDC, the Center for Disease Control, it is sometimes absent on initial measurement, especially in elderly, immunosuppressed patients or patients with pre-existing condition. COVID-19 or coronavirus is an infectious disease and had no vaccine to protect against it. According to CDC, it's an emerging, rapidly evolving situation, progressing to respiratory distress and requiring intensive care unit. Testing is done nationwide to assist those with symptoms. There is no specific treatment yet according to CDC. However, many of the symptoms can be treated and therefore treatment based on the patient's clinical condition. To protect ourselves and others, we need to stay home and limit going out if it's not necessary. Frequently washing hands with soap and water, and also we can use a regular sanitizer or with alcohol. Maintaining social distancing, avoid touching eye, nose, and mouth. Practice respiratory hygiene. When you're coughing and sneezing, you have to cover your mouth, and you can use paper towel, or you can do this when you're coughing and sneezing. If you're having symptoms, seek medical care as soon as possible. Government provides PPE and ventilators for hospital and facilities. Also, governments have shut down most essential business, school, public gathering places, and facilities. As of now, the scientists are racing to find the best drugs to cure coronavirus. A drug used to treat malaria is being tested of COVID-19. In conclusion, COVID-19 had done tremendous change in the entire world, especially countries that are most affected by it. Our government is doing the best they can to find treatment and hopefully soon to get back to normal. It is essential to practice a good hygiene and social distancing to prevent the virus from spreading. Hopefully soon we will be going back to normal again, and hopefully soon we will be going to be happy again. And thank you for helping me today, and have a good night.